Swine flu is a respiratory infection that can cause mild to severe symptoms. It is seasonal. If you think that your child may have this virus, call your doctor. H1N1 causes in babies: 1. Breathing in droplets after an infected person coughs or sneezes. 2. Touching a contaminated surface and then touching your eyes, nose, or mouth. The virus can survive on surfaces and infect a baby for several hours after being exposed to the surface. Symptoms of H1N1 in children: 1. Fever and chills. 2. Sore throat. 3. Cough. 4. Severe muscle aches. 5. Severe fatigue. 6. Headache. 7. Runny nose, nasal congestion. 8. Sneezing. 9. Watery eyes. 10. Gastrointestinal symptoms: nausea, diarrhea, vomiting. When to call a doctor: has a fever of 100 or higher and any of the following: 1. Stuffy nose. 2. Runny nose. 3. Cough. 4. Sore throat. Has been exposed to H1N1 flu by being within 6 feet of someone known or suspected to have H1N1 flu, living or having traveled to a place where there have been confirmed cases of H1N1 flu. How is H1N1 influenza diagnosed? Your child's healthcare provider will examine your child. Tell him or her if your child has health problems such as epilepsy or asthma. Tell him or her if your child has been around sick people or traveled recently. A sample of fluid may be collected from your child's nose or throat and tested for T. How can I manage my child's symptoms? Have your child rest. Rest will help him or her get better. Give your child more liquids as directed. Liquids will help thin and loosen mucus so your child can cough it up. Liquids will also help prevent dehydration. Liquids that help prevent dehydration include water, fruit juice, and broth. Clear mucus from your child's nose. Use a bulb syringe. Squeeze the bulb and put the tip into one of your baby's nostrils. Gently close the other nostril with your finger. Slowly release the bulb to suck up the mucus. Empty the bulb syringe onto a tissue. Repeat the steps if needed. Do the same thing. Soothe your child's throat. If your child is 8 years or older, have him or her gargle with salt water. Make salt water by dissolving teaspoon salt in 1 cup warm water. Soothe your child's cough. You can give honey to children older than 1 year. Give teaspoon of honey to children 1 to 5 years. Give 1 teaspoon of honey to children 6 to 11 years. Give 2 teaspoons of honey to children 12 or older. How can I help prevent the spread of H1N1 influenza? 1. Have your child wash his or her hands often. 2. Teach your child to cover his or her mouth to sneeze or cough. 3. Clean shared items with a germ-killing cleaner. 4. Wear a mask. 5. Keep your child home if he or she is sick.